Hello! Today I want to talk about diagnostic spirometry because the values that we found in spirometry lab before are great, but they don't tell us a whole lot clinically about the patient. The vital capacity, the tidal volume, they just tell me whether or not the patient is breathing and how much they're breathing. Here, I'm asking the patient to breathe in deeply and breathe out as fast as they possibly can and forcing that air out as quickly as possible. This will tell us two things. One, it will tell us the forced expiratory volume in 1 second, the volume of air that is exhaled in just that first second of that big exhalation after that deep inspiration. And it'll also tell us the forced vital capacity. That's the total volume of air that the patient can forcibly exhale in one breath completely. It is pretty much the same as the vital capacity itself, but this time I'm forcing the patient to do it as quickly as they can, which may make the value a little bit different. How do we find these values? Well, we just look at the graph and we look at the numbers and find what happens at that 1 second. Here's 1 second and trace it up to the line right there. What's the Y value there? Oh, about 3.2 or so happening after that 3. And then over here where the line plateaus is how much the big bad wolf could puff out, and therefore that would be a FVC of 4. And you'll note that I put those values one on top of each other because in the end I really care about comparing these two numbers in something like a ratio or a fraction. In fact, that is what we're really going to use in diagnostics, the FEV1 to FVC ratio. Here I'm going to compare the FEV1 of 3.2 to the FVC of 4, and when I divide those two numbers, I'm going to get a number of 0.8. You could also put this in terms of percentage of 80%. What this tells me is this patient could breathe out 80% of their vital capacity in just 1 second, and that is really, really good. What we don't want is for that number to dip down too much because then that patient might be having trouble whenever they're exerted under stress getting all that air out. So, what would that look like? Here's the normal graph, and I have 3.5 instead of 3.2, all the same here with the comparison of numbers. Instead, I want to see this blue line here. This is a patient that comes into you, and their FEV1 is 1.2, and their FVC is 3.6. If I were to put those into a comparison, the FEV1 and FVC ratio is going to be 0.33 or 33%, which is just awful. You want to be able to be way, way up from there. In fact, there is a clinical threshold of 70% before we suspect that a patient has an obstructive lung condition, as in there is some obstruction in the airways leading into the lungs, but the lungs themselves might be able to inflate completely just fine. This is only going to happen when the FEV1 and FVC ratio is reduced to less than 70% or 0.7. And this is the first thing we do when we look at these results. We want to look at the FEV1 to FVC ratio to see if it meets this 0.7. What kind of conditions are obstructive lung conditions? We have your classic COPD, which is a obstructive disease where a bunch of mucus is formed when you've been smoking for all your life. Asthma, as we know, is a kind of chronic condition that has mucus as well as the irritation, the swelling of the airways. You'll experience that more when you continue on to the next activities. And cystic fibrosis is actually another disease, a genetic disease that causes excess mucus to be formed in the alveoli and in the bronchioles, so much so that their airways are constricted to less than 50%. So it is a pretty severe disease. Now, here's a second patient that we have for ourselves. If we were to do the FEV1 to FVC ratio here, 2.8 divided by 3.2 is actually not that bad. 2.8 divided by 3.2 equals what? 0.8? And that's above that 80% threshold, isn't it? So this patient does not have an obstructive lung disease. But we do notice something very odd here, that this value of their FVC is very, very low compared to the maximum or normal that we should expect that patient to have. So if they pass the FEV1 to FVC ratio, but they still have problems getting as much air as possible, well, that's probably going to be a restrictive lung condition. The FEV1 to FVC ratio is greater than 0.7, but both the FEV1 and FVC are reduced. In this case, less than 80% of the predicted normal value. Here, the 0.4 to 3.2 is 80% on the money, 3.5 to 2.8. I don't know that math off the top of my head, but this would show me that this patient has something that is reducing the amount of usable volume inside their lungs. They literally cannot take in as much breath as they could before. They can do it at a fine rate. They can do it quickly, but not enough. Some conditions that can cause this kind of thing. We've got pulmonary fibrosis, where the lungs are stiffened or hardened and not able to inflate all the way. We've got a pulmonary edema, which is a collapsing, air bubble inside one of the bronchioles and alveoli that are preventing them from inflating and deflating. We might have someone with a pneumectomy, which is a removal of one of the lobes of the lungs. You might have some tumors blocking the amount. There are also some non-pulmonary causes of restrictive lung conditions, as in a person who is severely obese might not be able to breathe in as much because that fat is pushing on the diaphragm and reducing the volume of their chest cavity. Pregnancy could do that too. That kid is going to be pushing on that diaphragm. That diaphragm being pushed up reduces the amount of air that can be brought in on a normal inspiration. Overall, what this means is that this patient has a reduced volume, whether it's breathing in or breathing out, and cannot work with the full amount of breath that they normally would be able to. Let me know if you have any questions.